How do you treat ulcers caused by acid reflux? Imagine your esophagus as a delicate tube that can get irritated when stomach acid flows back up. When this acid damages the lining, it can cause ulcers, leading to pain and discomfort. The good news is that these ulcers can often heal with proper treatment. The main goal is to reduce the amount of acid that reaches the esophagus, giving the tissue a chance to recover. The most effective treatment for acid reflux ulcers involves medications called proton pump inhibitors. These drugs work by blocking the tiny pumps in the stomach lining that produce acid. By lowering acid levels, proton pump inhibitors help the ulcers heal faster and relieving symptoms like heartburn and chest pain. Usually, they are taken about 30 to 60 minutes before meals, and the length of treatment can vary from a few weeks to several months depending on how severe the ulcer is and how well it responds. Sometimes, doctors recommend continuing a low dose of these medications to prevent the ulcers from coming back. Alongside medication, making lifestyle changes can make a big difference. Losing excess weight if you're overweight can reduce pressure on the stomach and decrease reflux. Elevating the head of your bed by a few inches helps prevent acid from flowing into the esophagus during sleep. Avoiding meals close to bedtime, ideally 2 to 3 hours before sleeping, can also help. Additionally, steering clear of foods and drinks that relax the lower esophageal sphincter, such as fatty foods, alcohol, and tobacco, can reduce reflux episodes. Keep in mind that individual responses vary, so it's important to find what works best for you. In cases where ulcers are very severe or do not heal with medication, doctors might consider surgical options. Procedures like fundoplication involve wrapping part of the stomach around the lower esophagus to strengthen the valve that keeps acid out. Surgery can be helpful, especially for those who do not tolerate medications or have complications. However, it is not always a permanent fix, and some patients may still need medication afterward. Other medicines like histamine to receptor antagonists or antacids can provide symptom relief but are generally less effective at healing ulcers compared to proton pump inhibitors. Prokinetic drugs and other therapies are usually reserved for specific situations. Overall, treating ulcers caused by acid reflux involves a combination of medications to suppress acid, lifestyle adjustments to reduce reflux triggers, and sometimes surgery. Regular follow-up with your healthcare provider is essential to monitor healing, adjust treatment plans, and prevent future problems. Remember, each person's situation is unique, so personalized care guided by a medical professional is the safest way to manage this condition effectively.